I want to talk a little bit about pain today. Pain is why people come into the office, mostly at chiropractors. And they come in and they want their pain taken away. Who doesn't want their pain taken away? But I want to talk a little bit about this here for a minute. As a chiropractor, we're very, very concerned about the overall function of the body. Pain is a function of the body. If I would smash your toe with a hammer, you would expect to hurt a lot, but your body is letting you know there's damage there, and also that you shouldn't be putting weight on it or whatever else to allow it some time to heal. Pain is a very, very important part of the physiologic processes of the body. It lets you know that something's wrong. There's I forget the name of this, and you can look this up. There's a condition, a genetic condition, and it affects 1 in a million kids or much less than that, where these kids actually don't feel pain and they're born with it. It's a very, very serious condition. I was very tragically reading about this, and this one little baby girl, she did not feel pain, so she was scratching her eyeball, but she didn't realize she was destroying it while she was scratching it. And she ended up having to have her eye removed. It's really, really sad, at like 1.5 years old. So this is a terrible thing. Pain is in the body for a reason, and when there's no pain in the body, you have no messaging system saying something is wrong and you need to address it. So when people come into the chiropractor, they want their pain resolved. That's not a goal of the chiropractor. The goal of the chiropractor is to correct the cause. Why is the pain happening in the first place? What is causing that? So in this situation right here, here's a gentleman. This is one of the most difficult cases we've ever seen in the office. Obviously in a tremendous amount of pain, so much that had the pain pump put in, there's been multiple surgeries here in the low back, and still in a tremendous amount of pain. As a matter of fact, this doesn't even work anymore, but he stopped doing anything about it because it wasn't getting any results anyway. The problem was he was subluxated. And unfortunately, in this case, the fusion fused the bones in the subluxated, the misaligned position. So this is a very, very difficult case here. But the point is, the reason why he's still in pain is because there's problems in here. Pain is very, very important to recognize that there's something wrong in the body. The way chiropractors address pain is we don't address it. We address the subluxation. Now, oftentimes, these pain problems are specifically mechanical. And in a subluxation, when this is the nerve, when that vertebrae shifts backwards, that's starting to choke that nerve off. It doesn't matter if you drug this, if you burn it, it doesn't matter. The problem is still there. And this pain will not be resolved unless the subluxation is corrected by setting that forward. So that's chiropractors deal with that. Now, pain, again, very, very important to the body to let you know that there's a problem. In medicine, the goal is to treat symptoms, and pain is certainly a symptom. Back pain, lumbalgia, they're going to try to treat the symptoms, and they'll do it chemically, physically with physical therapy. They'll do it, even some people will do mental techniques on how to get over it. Chiropractors deal with the mechanical interference of the nerve. Now, I want to differentiate here between pain and suffering. Suffering is very, very different. Animals and humans both experience pain. Humans are the only ones that experience suffering. Have anybody ever seen a 3-legged dog upset? No, they get along perfectly fine. Pain in the animal kingdom is there because it is one of the things that will tell an animal that you need to rest, stop, slow down, and then let the body heal up. In humans, we suffer. We can experience suffering. Oh, there's so much pain in my leg, now I can't work out, or I can't sit at my desk. Oh, woe is me. There's a lot of suffering that is involved here. Where pain is strictly physiological, suffering is strictly mental. So you have to differentiate the two. Pain is something very, very good. It's letting you know that there is a problem with the body. It needs to be resolved. It's letting you know there's a problem. Chiropractors look for the cause of the problem, whether it's pain, whether it's whatever symptom you're dealing with. We look for interference. If you have a subluxation where the vertebrae is choking off one of those nerves, the organ or the muscle or whatever's at the end of that is still going to work, but not as well. Oftentimes, your body will let you know that there's this condition because of pain. It's not necessary, but it's very common. So as a chiropractor, what we're doing is we're just removing the interference to the nerve, allowing the body to function better. So again, to sum up here, pain is a very, very essential part of physiology. Thank God you have it, because that's showing you that there's a problem. Now you can address that problem. Suffering is something strictly mental, very, very different. Pain is common throughout the animal kingdom, throughout the human kingdom. Suffering is very, very specific to that. So when you're dealing with this, instead of treating the pain, look for the cause, and that's what we look for as a chiropractor.